Before touching the patient and all these things, it's always a good idea to have nice clean hands. Obviously I'm going to be wearing gloves in a minute, but for this early preparation part it doesn't hurt to keep the germ count down. And if you ever wear gloves with wet hands, you won't get your gloves on very well, so it's good to have nice and dry hands. So now I'm going to give him a local anesthetic so that he doesn't feel the rest of the procedure. This is a little alcohol swab, and that alcohol isn't quite as good as betadine, but it gets the job done for when you're just sticking a sterile needle under the skin. And so what I do is, if you see this lesion right here, it's pink and scaly, you're not going to be excising anything, but I'm just showing you for demonstration purposes. I'm going to come out to the side and inject under the skin and follow along one side as I inject, and the needle is advancing. And you can kind of see the skin raise up and blanch perhaps, and it's getting thicker as the anesthetic is being injected. The patient is making a little bit of a face because epinephrine stings. And just come out and fan it out the other direction. You want to get a good coverage out to the sides of the lesion. And you come along the side border here. Since that's numb, that shouldn't be feelable by now. And then he'll feel another burn as I inject the far end of the apex. And that's 3 cc's, and I'm going to go grab another 2 cc's of lidocaine. This bottle is now contaminated and should never be used on anyone else. It will be discarded because this needle entered his skin and it has biological material from him, which hopefully doesn't have any viruses in it, but we just would never use that bottle on anyone else. We will be discarding that. And I've come to the south end of this lesion, and it should be nice and numb. And as I test it out, I'll poke him a little bit here and ask if he feels anything sharp.
Not yet.
Okay, so that area, that whole zone, and it's imperceptible, but he's starting to blanch because this has epinephrine, and you got pink area over here, pink area over here, and it's paler here because of the vasoconstriction. This scar over here we did some time ago, and it had a similar lesion, which was a squamous cell carcinoma.